So now we are going to discuss in detail about the digastric triangle. So we have got anterior triangle, totally 3.5 triangle. In that the complete triangle is digastric triangle. One among the three triangle we have got digastric triangle. As the name itself indicates, this digastric triangle is seen between the two bellies of digastric muscle. So we are calling it as digastric, or else it is also called as or submandibular triangle. Why we are calling with this name as we have got important gland present over here, so we are calling this as submandibular triangle. So digastric triangle, or else it is called as submandibular triangle because of its content. Now we will discuss about the boundaries of the digastric triangle, then we will move on to contents of this particular triangle. So talking about boundaries, as we already have discussed, I will tell you again. So we have got again mandible in the midline structure. So what are the things necessary we have drawn here? So this is the mandible and this is the hyoid bone. And this one sternum, manubrium of sternum, and this is the clavicle part. Okay. And this we have got styloid process and this is the mastoid process. Now we have got two muscles, that is we have got from the symphysis mentae, behind that we have got digastric fossa. From the digastric fossa of mandible we have got a muscle coming. So that muscle is nothing but anterior belly of digastric. So we have got a muscle coming, that is anterior belly of digastric. Same way posterior belly of digastric is taking its origin from the mastoid notch. Just behind the mastoid process we have got a notch we will call as mastoid notch. From this mastoid notch we have got a muscle originating, and this muscle is going to come and getting connected to a common tendon present between these two bellies. So these two anterior and posterior belly is joined together by a common tendon which is forming a sling to connect it with hyoid bone. So this is anterior and posterior belly of digastric. So we have got two muscles, anterior belly of digastric. So this is anterior belly of digastric and this is the posterior belly of digastric. Okay. So anterior belly taking its origin from digastric fossa getting inserted into common tendon. Posterior belly is taking its origin from mastoid notch and getting inserted into common tendon. Now we are dealing about triangle. This digastric triangle is bounded above. So here you can make out above it is bounded by lower border of mandible. So above it is bounded by lower border of mandible. Imaginary line drawn from mandible to the mastoid process and also the lower part of mastoid process. So till here we have got base or above boundary of digastric triangle. Same way below and behind, that is we can call this as postero-inferiorly. Okay, so superior or above boundary, and then we have got postero-inferior boundary or below or behind. It is bounded by posterior belly of digastric. Right? So below and behind it is bounded by posterior belly of digastric. Below and front it is bounded by anterior belly of digastric. So these are the three important boundary we have got for digastric triangle: antero-inferiorly, postero-inferiorly and base. Now we have got apex. Apex is found by common tendon where we have got anterior and posterior belly getting inserted. So this is the whole of digastric triangle we have got. So in this triangle again we have got floor. So roof you already know, we have got skin, superficial fascia, and then we have got platysma, again deep cervical fascia with a small branch coming from cervical branch of facial nerve, and also we have got transverse cutaneous branches, ascending branch coming towards here. So skin, superficial fascia and deep cervical fascia with platysma is the common roof structures seen in all triangles over here. Now talking about floor, which will be different in each triangle. Here we have got the floor muscle as mylohyoid muscle. Here we have got a muscle, that is mylohyoid muscle, which is orodiaphragm muscle. So we have got mylohyoid muscle, And also we have got hyoglossus muscle. We have got one more muscle which is present over here, that is hyoglossus muscle. And also a part of constrictor muscle also will be seen, middle constrictor muscles. So now you remember the floor of the, so we have got like this, we have got the muscles forming the floor of this and digastric triangle are, first we have got mylohyoid muscle, which is a oral diaphragm muscle, and then we have got second muscle as hyoglossus muscle. Hyoglossus muscle. Then we have got constrictor muscle, middle constrictor muscle. So all these three muscles are going to contribute for the floor of the digastric triangle. So as I said, we have got base, apex, anteroinferior and posterior-inferior boundary for digastric triangle. So here no need to show. So as I already know, we have got a muscle over here, that is sternocleidomastoid muscle. So just for remembering, you just remember in front of the sternocleidomastoid only we are getting to see all the anterior triangles which we are divided into some subdivision. Now in this video we are dealing only about digastric triangle. Can make out the violet demarcation. So this is the digastric triangle which we are dealing now. Now we will move on to the contents of this digastric triangle. Talking about the contents of digastric triangle, we are going to divide this triangle into two compartments, anterior and posterior. For that, I will just make a mark. This is mandible and this is hyoid. And this is the mastoid process and this is the styloid process. Okay. Now this is the imaginary line we have got. We are dividing this into two aspects, anterior and posterior aspect, by means of stylohyoid muscle. Here you can make out a dotted lines that is connected from styloid process to the hyoid bone, that is stylohyoid muscle. So this muscle is dividing the, for our convenience we are dividing the digastric triangle again into two for remembering the contents in a easier way. So we have got anterior part and the small posterior part. So we will deal about the contents here now. So talking about the contents of digastric triangle, first we will move on to the posterior aspect. This posterior aspect we have got only three contents present. So we are having posterior contents and anterior contents. So posterior contents are 3 in number. We are going to three structures. In anterior we are going to see 5 structures. Altogether we have got 8 structures or 8 contents present in digastric triangle. And moving on to posterior aspect. So before that, you know, this is the muscle posterior belly of digastric. Posterior belly of digastric muscle. This is anterior belly of digastric muscle. Between that only we are having the stylohyoid muscle which is dividing the triangle into anterior and posterior aspect. You can make out here posterior aspect is much smaller, and in this posterior aspect we have got 3 contents. One is part of the parotid gland. We have got part of parotid gland present over here. We have got parotid gland. We have got 3 salivary gland. One is parotid, another one is submandibular, another one is sublingual gland. Among that, the parotid gland. So this is parotid gland. A part of the apex of parotid gland will be seen in the posterior aspect of digastric triangle. Along with this, we have got an important artery coming over here. So we have got external carotid artery. We have got our external carotid artery coming towards the digastric triangle. So this external carotid artery is covered by a sheath called carotid sheath. So that also considered as a content seen over here. So we have got 3 contents present in the posterior aspect of digastric triangle. One is parotid gland, and this is external carotid artery, and this is the carotid sheath which is covering the external carotid artery sheath. This external carotid artery, after reaching the parotid gland, it is going to pierce and go inside the parotid gland. Here you remember we have got 3 structures in posterior aspect. One is parotid gland. Second is external carotid artery. And the third one is carotid sheath. So these are the three important structures in the posterior aspect. Moving on to the anterior aspect, we have got again one more salivary gland. That is, we have got our submandibular gland. We have got our submandibular gland present over here. So we have got first structure present here is in the anterior aspect. 5 are there. One among that is submandibular gland. Submandibular gland. And then you can make out from the external carotid artery we have got a branch coming over. So that branch is going to pass above the submandibular and then it is going to reach the face. So this is facial artery. We have got external carotid artery giving 8 branches. One among that is facial artery, which is a third branch. So this external anteriorly we have got 5. Among the third branch is facial artery. This facial artery is given from the external carotid artery towards the anterior aspect. So we have got second structure as facial artery. Then we have got a vein coming from the face which is going to pass over here. So facial vein is also going to come towards the digastric triangle. So the vein present over here is facial vein. So we have got 3 structure, one gland, submandibular gland, and then we have got the facial artery, and the vein which we have is facial vein. Along with this, we have got a nerve present over here, and that nerve is 12th cranial nerve. That is, we have got our hypoglossal nerve. We have got our hypoglossal nerve. So this is the nerve we have got. So we have got our hypoglossal nerve. This is hypoglossal nerve. So 4 structures we have seen: submandibular gland, facial artery, facial vein and hypoglossal nerve. Along with that, we have got floor muscle as mylohyoid muscle, and that mylohyoid muscle is supplied by a vessel coming from maxillary artery, that is mylohyoid artery and vein. So mylohyoid artery and mylohyoid vein which is supplying the mylohyoid muscle. Along with that, we have got a nerve coming from mandibular nerve, that is mylohyoid nerve. So these are the structures seen in the anterior aspect of digastric triangle. So this is mylohyoid, nerves and vessels, nerve and vessels. So I hope you all understood. We have got 5 structures. One is submandibular gland, here parotid gland in the posterior aspect, and then we have got our facial artery, and then we have got our facial vein, and nerve we have got is hypoglossal nerve which is a 12th cranial nerve, and then we have got mylohyoid vessels and nerve which is supplying the mylohyoid muscle, which is a floor muscle in the digastric triangle. So these are the details we have to remember while we are talking about contents of this digastric triangle. So contents altogether 8 in number, anteriorly 5, posteriorly 3 in number. So while you are explaining any triangle, you have to explain first the boundaries of that particular triangle. Along with that, you have to tell about the contents of that particular triangle. Thank you for listening.